With that, let's open it up for questions. Kevin?
Thanks, Jeff. I know there's a ton of questions today, so please keep your questions to one question, as I always say, but especially today. First, let's go to Caitlin Collins at CNN.
Thanks. Two quick ones for you. One, has your definition of fully vaccinated changed? And if not, do you expect that it will? And secondly, several of you have said the travel restrictions that were put in place yesterday are to buy time to study this new variant and evaluate it. So what specifically are you doing with that time that you're buying to make sure that you're using it wisely?
So fully vaccinated definition, Dr. Walensky.
Yeah, thank you, Caitlin, for that question. So the definition of fully vaccinated has not changed. That's after your second dose of the Pfizer or Moderna vaccines, after your single dose of the Johnson & Johnson vaccines. We are absolutely encouraging those who are eligible for a boost 6 months after those mRNA doses to get your boost, but we are not changing the definition of fully vaccinated right now. Thank you.
And Dr. Fauci, how we're using the time to learn more about the variant and prepare?
But thank you, Jeff. Thank you, Caitlin. Well, one of the things you do is you get the virus and you grow it, or you put it into a modified form called a pseudovirus. And when you do that, you can then get convalescent plasma, monoclonal antibodies, as well as sera and antibodies that are induced by the vaccine to see if they neutralize the virus. That will give you a pretty good idea as to what the level of immune evasion is. As I mentioned in my brief comments, the molecular configurations of the mutations can give you a suggestion of immune evasion, but that's one of the things you can do, is to take a look what the antibodies actually do. That process will take likely 2 weeks or more, perhaps even sooner, depending upon how well the virus grows and the isolates that we get. That's the first thing. The second thing is you can do what Dr. Walensky said about continuing the surveillance and trying to get a feel for what the situation is in the United States. And in those countries in which there are a lot of cases, like South Africa, the computational biologist and the evolutionary biologist are going to be getting a good feel as to what the competition of this virus would be with Delta. Those are just a few of the things that will take a couple of weeks to a few weeks to learn. And when we do find that, we'll have a much better picture of what the challenge is that's ahead of us. Thank you.
The only thing I'd add, Caitlin, is it's also a really important time for those who have not gotten their booster, 100 million eligible Americans, to get their booster, and for parents to get their kids their first shot or their second shot, and for those adults who yet to get vaccinated, for them to get their first and second shots. So operationally, we want to make sure that people are doing all they can to protect themselves. Next question.
Go to Aaron Billups at Spec News.
Hi, thanks for taking my questions. First, I was wondering, are enough Americans getting tested? Many people are taking rapid tests at home. That data doesn't get to labs participating in surveillance. Is this hurting or limiting surveillance? And also, the messaging is kind of confusing that the virus may evade our current vaccines or immunity from previous infections, but that people who haven't yet should get vaccinated. Can you clarify why getting boosted or vaccinated with the vaccines currently available would potentially be protective against Omicron?
Okay, Dr. Walensky on the first question about testing and surveillance, and then Dr. Fauci on the protection of the vaccines.
Yeah, so we're doing, about 1.5 million PCR tests every week. And of course, those rapid tests are really helpful from a public health standpoint. And many of those rapid tests that are positive are actually confirmed by PCR. So given that we have all of that testing going on, those tests now we're the PCRs, we are doing about 1 in 7 genomic sequencing. So a really broad amount of surveillance that is happening from a genomic sequencing standpoint. And there's really an important role of those rapid antigen tests so that people can continue to screen themselves and protect themselves.
Dr. Fauci?
Yeah, that's an excellent question. So let me explain. The vaccines that we used are directed against the original, what we call ancestral strain, or the Wuhan strain. So you get a certain level of antibodies that are specific against that strain. Then we had the evolution of variants, including, for example, the very problematic Delta variant. So if you look at the mutations on the Delta variant and you look at its function, you actually diminish somewhat the protection that is induced by the vaccines. However, when you get a high enough level of antibody, and it's not only antibody, it's other elements of the immune response, particularly when you boost it, you get a level so high that even if the mutations of various variants diminish that level of protection, you are still within the range of some degree of protection. And that's usually most manifested in protection against severe disease that leads to hospitalization. So when we say that although these mutations suggest a diminution of protection and a degree of immune evasion, you still, from experience that we have with Delta, can make a reasonable conclusion that you would not eliminate all protection against this particular variant. And that's the reason why we don't know what that degree of diminution of protection is going to be, but we know that when you boost somebody, you elevate your level of protection very high. And we are hoping, and I think with good reason, to feel good that there will be some degree of protection. Therefore, as we said, if you're unvaccinated, get vaccinated. And if you're vaccinated, get boosted.
Next question.
Cheyenne Haslett at ABC News.
Hi, thanks for taking my question. Director Walensky, you talked about how much our surveillance program has improved, but is there still work to be done? Is there a reason to be concerned that other countries have detected Omicron while the US has not, or is it possible that it's actually not here? And then for Jeff, you talked about this a bit, but companies have said it'll take less than 100 days for a variant-specific vaccine, which is 3 months, but can you clarify how much longer we should be saying the FDA and CDC process would make that whole process? Thanks.
Yeah, maybe I'll start, Cheyenne, and say we have a really robust surveillance system right now. Certainly, this has been detected in other countries, but other countries also have different policies for international travelers. One of the things that's really robust here in the United States is our international travel policy, where we have pre-departure testing, both for people who are unvaccinated, but also for people who are vaccinated. So I do believe with all of our international travel policies that have helped to keep Americans safe, as well as for our really robust surveillance system, genomic surveillance system, we do have the detection mechanisms that we need in place in order to find it, should and when it occurs.
Good. On the question about preparing for the possibility, the contingency plan of a potential modification of the vaccine manufacturers are working on possible modifications to the vaccine and have been since late last week. These are, on an if needed basis. Our doctors and scientists across the government are already in discussions with the 3 manufacturers on this scenario. And this includes conversations about the most appropriate regulatory pathway for review and authorizations, discussions about the tests that would be most appropriate to study the vaccine effectively and efficiently. These conversations are happening as we speak in the spirit of being prepared for any scenario, and we will remain in close contact with the drug manufacturers through the days ahead as we learn more about the variant. The companies currently estimate that it would take a few months to prototype and manufacture a modified vaccine or booster, and that does include, to your question, the time for FDA and CDC to do their evaluation. So the estimate of a few months is all inclusive. Next question.
Josh Wingrove, Bloom.
Thank you kindly. Dr. Fauci, can you address the question of severity of disease from the cases that we know? It's been sort of widely said that we shouldn't overinterpret what has been seen as mild cases because some of these might be in younger people or be early on in the case sort of progression. Is that your view as well? In other words, what do we know so far? You said it's too early to tell, but what clues or breadcrumbs do we have about how severe these cases that we are seeing so far are? Thank you.
Yeah, that's a good question. Be careful about breadcrumbs. It may not tell you what kind of loaf of bread you have because we really don't know. There have been, as you mentioned correctly, some anecdotal reports out of South Africa that the physicians, mostly private physicians, who've been seeing patients are seeing that they appear to be a less of a severity of illness. But you said quite correctly, most of those are among younger individuals. We believe that it is too soon to tell of what the level of severity is. Dr. Walensky and I specifically asked our South African colleagues that on the most recent Zoom call that we had, and they agreed with us that it's too early to tell. They're hoping that it is going to, across the board, give a lower level of severity, but they don't know that right now. So they agree with us and we agree with them that it's just too early to make a definitive prediction about what the severity is going to be. We will know, though, because they are really looking at this very carefully. That gets to the 2 to 4 weeks that I was talking about on one of the slides. We should have a much better idea within the next few weeks.
Next question.
Shannon Pettypiece, NBC.
Hi, thanks for taking my question. I wanted to follow up on the timeline question one of my colleagues asked a moment ago. I understand that pharmaceutical companies say it would take several months for them to come up with a new vaccine if that worst case scenario occurs. Under this worst case scenario where people would need to get another booster, another vaccine, what does the timeline look like for how long it would take to have enough doses to revaccinate the 300 million some Americans who are already vaccinated? And what's some of your planning for how that would work, how that sort of worst case scenario would work if we were to need a new vaccine?
Right. So the few month estimate that I discussed not only includes the prototype, obviously the FDA and CDC authorization and recommendation, but also time to manufacture enough doses for the American public. That's obviously an estimate, and we are planning in that scenario not only for supporting the manufacturers through that process if needed, but also for how would we rapidly get shots in arms. And we know how to do that given the experience we've had of the last year. And that is lessons learned about how we deploy the federal pharmacy program, set up mass vaccination sites, go to community health centers and rural clinics. So all that type of planning is part of our contingency planning, so we could get shots in arms efficiently and effectively. Next question.
All right, we have time for a couple of more questions. Let's go to Zeke Miller at AP.
Thanks for doing this. Jeff, I was hoping you might be able to provide an update on the duration for these travel restrictions on South Africa and the countries in the region there. What metrics are you looking at to see when to ease those? And then to follow up on Dr. Wentz's question, or answer to Caitlin's question before, given what we've seen through the vaccination campaign over the last year, that, a lot of people just don't get vaccines unless they're really forced to. Why isn't the CDC taking sort of a step of changing the definition of fully vaccinated if boosters are as important as you say they are to prevent against Delta, but also Omicron?
So in terms of the travel restrictions, we will learn more about the variant as we've been discussing across the last half hour of transmissibility, the severity, vaccine effectiveness. We'll learn that across the short period of time. And based on the data and the science, the medical team will make a recommendation on any changes to international travel policy. Dr. Walensky?
Yeah, and what I would say, Zeke, is that we are continuing to follow the science in this area. Certainly, our recommendation for boosters that was updated yesterday is related to Dr. Fauci's comment that the more mutations you have, the more you'd like to bolster your immunity. And as that science evolves, we will look at whether we need to update our definition of fully vaccinated.
Last question.
All right, last question. Let's go to Jeff Mason at Reuters.
Thank you very much. This question is for Jeff and for Dr. Fauci. President Biden yesterday referenced the fact that before the U.S. can be fully protected, the rest of the world needs to be protected. I'm well aware of how many vaccine doses the U.S. is donating, but my question for you, Jeff, is what more is the United States going to do to get more vaccines to the rest of the world? And for Dr. Fauci, do you think the U.S. is doing enough?
Dr. Fauci, do you want to go first, and then I'll follow?
Well, the question directly to me, the word enough is a very, very unusual word because it really compared to what? Are we doing a lot? We are doing a lot. We're doing more than all the other countries of the world combined. That's really very important. We have promised or giving 1.1 plus billion doses, 275 million of which have already been given to 110 countries. One of the frustrating aspects of this is that the logistic capability of getting vaccines into people's arms in Southern African countries and in other low and middle income countries is really very difficult. And in fact, many of the doses that have been shipped have not been used, and other African countries on the African continent have actually told us not to ship any more vaccine because they have not been able to adequately utilize it. So again, enough is a tough word. Are we doing a lot? We are doing an awful lot. Back to you, Jay.
Yeah, let me pick up there. We have sent the 275 million doses to the world, and as Dr. Fauci said, that's more than all other countries in the world combined. And this includes 94 million to Africa as a continent and 13 million to Southern African countries. I think the shots in arms piece that Dr. Fauci talked about, the last mile, if you will, is really important. And the U.S. State Department and USAID are leading the administration's effort to turn vaccines into vaccinations. They've helped train health workers to administer vaccines around the world, run local media campaigns to answer questions and increase vaccine confidence, and launched mobile vaccination clinics, the type that we have here in other countries. Specifically, USAID has deployed nearly $1.6 billion to countries in sub-Saharan Africa to fight the pandemic, including more than 61 million to South Africa alone. And this involves field hospitals, training health workers, and supporting national campaigns to, as I mentioned earlier, national and local campaigns to build vaccine confidence and combat misinformation. So around the world, USAID is building data systems to track vaccine deployments. They're providing training to health workers and setting up vaccination sites. They'll continue this vital work, and it is increasingly important as there are greater and greater supply of vaccine around the world. And I think just overall, stepping back, the United States is doing just what the president said we would do, which is leading the effort to vaccinate the world, including helping with that last mile, but also by supplying the 1.2 billion doses to the world with no strings attached. These are all donated. And we'll continue to share more and more doses. We're going to continue to help scale manufacturing both here and in other countries. And we're going to do all we can to get the world vaccinated because we know we're not safe here until the world is vaccinated, and it's the right thing to do. So thank you for today's briefing. We look forward to briefing later in the week.